Now to Romania, a country with one of the lowest COVID vaccination rates in the EU. Only a third of adults are fully vaccinated. The president has described the situation as catastrophic, and in rural areas, vaccine hesitancy is strong, particularly in the southern town of Gaesti. DW correspondent Fanny Facsar paid a visit to an area where hospitals are overwhelmed and understaffed.
The more rural it gets, the more people are reluctant to get the jab in Romania. We are in the town of Gaesti. There are currently over 90 COVID patients in the local hospital and only 4 doctors. Laurențiu Belușica is one of them. His enemy, time. He takes us to the red zone. We film with the hospital's phone to reduce the risk of contamination. Inside the red zone, there is a lack of everything, especially oxygen.
I need 150 every day.
And how much do you have?
25?
25 every day.
I think, yes.
He and his team can do little for the patients. There is a lack of medicine and personnel. 95% of those who end up here are unvaccinated. Many die. Rural areas in Romania have been hit hard by COVID. But there is little trust in the vaccine or in the government. Conspiracy theories are rife and reasons to refuse the vaccine vary.
I'm not vaccinated. I am against it because I don't believe in the virus. I didn't make a decision yet. I'm waiting. I don't know for how long. Some months.
A dramatic upsurge in cases and a rolling average of 300 people dying each day. More people have turned up at vaccination centers in the capital Bucharest to get their shot. But it's not enough to turn the situation around. Currently, only 1/3 of the population has been vaccinated. Romania was off to a promising start, but vaccination slowed down, exposing millions to the virus. About 14% of Bucharest's population is infected with COVID-19, and that number keeps rising, especially amongst the unvaccinated population. Now, despite that, many people remain skeptical of the vaccines. State officials want to find a way out of the crisis, but how?
Right now, what we can do is to highly increase the vaccination rate. For instance, if you get vaccinated with a vaccine that is administered in one single dose, that means that in 14 days you'll be having maximal immunity.
For Laurențiu Belușica and so many chronically underfunded hospitals, it's all too little, too late.
I'm tired. Tired. Maybe. Not maybe. For sure. A little discouraged.
Belușica maintains the pandemic is still not being taken seriously by the authorities.
We don't have enough oxygen or funds for medication, and soon the 5th wave will be here.
The ambulances continue to arrive with COVID patients, even though there aren't enough beds to take care of them.
Well, that report from DW correspondent Fanny Facsar, who joins us now from Bucharest. Welcome, Fanny. How is it that people there are still so reluctant to get vaccinated?
It's really hard to understand. In fact, the situation in Romania is quite bizarre. I find so many people telling me they're more scared of taking up the jab than actually getting the virus. In fact, the hotel where we are checked in, some of the staff is not vaccinated. At the same time, they asked us to show our vaccination cards, which of course we could present. Ask them why that is. They say they're scared. They don't know about possible side effects. Now, that misinformation is, of course, part of this entire crisis, but there's also criticism. In fact, also from the president yesterday, President Iohannis, he said that the government, currently an interim government, didn't do an effective job to actually raise awareness and make sure that this problem is tackled, a problem that is actually at this point a catastrophe, and absolutely it's unclear how a solution is going to be in sight.
So is there a plan to try and increase the rate of vaccination there?
There are various theories, but what can you really do on a practical level? That's the big question here. The healthcare system is completely underfunded. That hospital that we went to, the doctor said he would be so relieved if the patients could afford to buy medicine themselves, but they can't. Also, the budget of these hospitals, they simply cannot afford something as simple as buying enough oxygen tanks. Now, President Iohannis today called an emergency meeting with various state officials to find a way out of this crisis. One way to do this is to say again and again, people, get vaccinated. Hear the message. It's not 5 to noon, but it's already 5 afternoon.
All right, but if you have vaccine shortages, you have this catastrophic underfunding in the health system, how do they do anything about it? I mean, is there a plan to do anything about the hospital supply shortages?
The plan currently is actually to try to minimize contact in between people. That would actually mean some sort of a lockdown. But already a few regulations, a few rules and restrictions have been in place since last week that unfortunately nobody really seems to care about. For example, restaurants are supposed to operate at half capacity. The restaurants we went to operate at full capacity. Staff there say, we cannot send guests away. And when it comes to hospitals, what's happening here, Romania is reaching out to the EU, is reaching out to neighboring countries like Hungary to take in patients, but also to bring in some oxygen. So the situation is actually quite desperate at the moment, as I say, and it's really unclear when actually this crisis has reached its top level. It's still a nightmare developing.
OK, thank you for that. Fanny Facsar in Bucharest.